In this video, we're going to talk about my top 5 recommendations for pain control after top surgery. Always check in with your own surgeon, but these 5 things can really be game changers after top surgery. Now, first of all, how painful is top surgery? In my practice, we scored patients on their pain several years ago, and we found that the mean pain score is about a 4 out of 10 in the first 2 days, and then it gets better. We're already doing a lot of things in my practice to make things as comfortable as possible. We never put drains, for example. We get out of the binder really fast, and we use what's called a block in there. It's a numbing medication, which is long acting, which can really get on top of pain. So in our practice, more than half of patients now actually go without the stronger medicines or the narcotics. However, these are 5 things you can do yourself at home after top surgery in order to help make your pain less. Okay, so number 1, never underestimate the effectiveness of ice packs. Check with your own surgeons. Most of us recommend not to put it directly on the new nips. That's very important, but out underneath the arms, it can really make a difference, number 1. Number 2, check in with yourself. There's something very interesting, especially I find about surgical pain. It can sometimes be very difficult to tell the difference between actual physical pain and other emotions like anxiety. So breath work can really help with this, grounding exercises, and just checking in with yourself and saying, hey, is this actually pain? Or is it nerves or something else that's going on? Things like journaling can also be really useful as well. Tip number 3, when you get out of top surgery, usually when you wake up, you already have a binder on you. I've been through multiple iterations of the different types of products of binders available out there. None of them are perfect. And sometimes that binder may catch in a spot, a sore spot. A very typical one is right underneath the arm. So check in with your own surgeon, but it may be possible to adjust that binder or to loosen it so you're not suffering from pain from the binder itself. In my practice, because I use the drain-free technique, if a patient really isn't doing well with the binder, well, we get rid of it. It helps probably the first kind of 48 hours with swelling, the way we do our surgical technique, but it's not a deal breaker if the patient's just not tolerating it. Number 4. Surprisingly, a lot of patients report that after top surgery, where the pain actually occurs, it's not where you think it is, where the incision is, it's actually in the shoulder and neck after surgery. So massages in a sitting position or using any of the products from the pharmacy for neck and muscle spasm can really help alleviate this. A neck pillow is a game changer as well. And finally, tip number 5, don't forget the other over-the-counter pain medicines. Always check with your own doctor first, but in my practice, we love ibuprofen, for example, and in some folks, depending on their genetics, they may respond a lot more effectively to things like ibuprofen than the stronger narcotic pain medicines after surgery. We always want to err on the side of the NSAIDs or the over-the-counter pain medicines if we can, because most of the problems folks have after surgery are related to the narcotics. It's not what you think, it's not addiction, that's very rare, but narcotics really constipate you. That's super common. Nauseate you, it's usually why we have to give nausea medications, and just kind of make you loopy, slow down your recovery overall, make you bloated, and ultimately not feeling so good. So everything in our practice is geared towards minimizing these narcotics, and that way you're going to recover faster and you're going to feel better. And those were my top 5 things you can do yourself after top surgery. However, always check in with your own surgeon.